I start by introducing myself. I let her know I'm a student physical therapy assistant and I get her consent for me to work with her. And then I also verify who she is. Then after I have her lay into supine, I'm going to let her know that we are going to be doing some passive range of motion, testing her knee extension. And then as I am passively putting her knee into knee extension, I'm feeling her end fields. Next, I have the patient sit up so that we can do a general growth strength test on her knee extension. After passively putting her knee into knee extension, I have her do it actively. I'll have the patient keep her knee at about 45 degrees extended, and then I apply pressure at her distal ankle joint towards the ground. Freehand stabilizes her knee, and she scored A5. Next, I'm going to be measuring her knee extension, and first I start with her left knee in order to get a baseline. So then I measured her left knee into extension, and after measuring it on her left knee, she got 5 degrees of hyperextension.
Friday?
Oh, go ahead and extend. So we got 5 degrees. And then we are going to do this one. Then I measured her right knee, which is the affected leg. And after I measured it, she measured at 3 degrees of hyperextension, which means in total, she had 2 degrees of hyperextension in her knee. Next, using my goniometer, I'm going to measure her knee extension. I'm going to make sure to place a towel under her Achilles tendon,
slight hip extension,
so that I'm able to
30 to
measure
4
for
degrees
any
of knee
hyperextension.
flexion with her heel flat on the floor.
Stationary is in line
My
with the
stationary is going to be
metatarsal,
in line
the
with her
fulcrum at the
femur.
lateral
The movable
malleolus,
is going
and
to
the
be in
movable
line
follows
with
the lateral fibula, and the fulcrum
Next,
is going
I
to be
test
right
it
in
with
line
her
with the femoral
non-affected
condyle.
leg. For the goniometer,
Normal
it's going to be all
degrees
the same
of knee
landmarks.
extension is 0 to 10 degrees, and my patient had a
And then
degrees
I
of
compare the
5
degrees.
for knee extension.
For her non-affected leg, she had
So she's
65
in within
degrees,
normal limits.
and for her affected leg, it was 60 degrees.
And then that's going to be your, or whatever, just go for it. Perfect. And you got that degrees. Okay, you stop it. So I'm going to be doing a manual muscle test on her medial hamstring. She's going to be laying prone. Her knee is going to be flexed 50 to 70 degrees. Her hip in slight internal rotation and her lower leg slightly internally rotated on the femur. I'm going to apply pressure on the distal lower leg in the direction of knee extension. My free hand is going to be stabilizing the ipsilateral pelvis. And after doing the test, the patient scored a 5. Next, I'm going to be doing a manual muscle test on her flexor hallucis longus. The patient's going to be seated, and then she's going to extend the great toe. I'm going to apply pressure against the dorsal surface of the proximal and distal phalanges into flexion. My free hand is going to be stabilizing the posterior calcaneus, and after doing the test, the patient scored a 5. The special test that I'm going to be performing is called Ellie's test. The purpose is to assess for tight rectus femoris. So she's going to be in prone, and then I'm going to passively flex the patient's knee. A positive test is indicated by spontaneous hip flexion occurring simultaneously with knee flexion and may be indicative of a rectus femoris contracture. My patient tested negative.